Вітаю, шановні колеги. Пропоную розпочинати
Hi,
шосте
colleagues.
засідання
So
15
let's
грудня.
start because it's
Мабуть, що кожен буде ще
15:01,
доєднуватися, але я
3:01
думаю,
p.m.
що
I think others will
враховуючи
join
насиченість
us,
нашої
but taking
сьогоднішньої
into
програми,
account
можемо
how
вже розпочинати.
packed our agenda is,
Власне,
we can
вітаю вас
start.
на
So,
черговому засіданні
welcome to one
технічного
more
робочого групи
meeting
з
of the
психічного здоров'я
Technical
та
Working
соціального
Group on Mental
здоров'я
Health and
в
Psychosocial
Україні.
Support
Мене
in
звати Катерина
Ukraine.
Крижик,
My name
я
is Katerina Kryzik,
співголовуючий
and I am the
групу від
co-chair of this
Організації
group on
охорони
behalf of
здоров'я.
the World Health
І також
Organization.
на
And
національному рівні
also on the
це
national level, this group
Міжнародний
is
офісний
co-chaired
офісу
by
та
International
Координаційний
Medical
центр
Corps
психічної
and
здоров'я
the
Кабінету міністрів
Coordination
України.
Center for Mental Health of the
Власне,
Cabinet of
сьогодні ми
Ministers of
з
Ukraine.
вами в такому
Today we
форматі,
have
який ми
the
називаємо технічною
format
дискусією.
that we name a
Саме ми
technical
обираємо якусь
discussion,
тему для того,
and
щоб
we
її
choose the topic
обговорювати, для того,
to
щоб слухати
discuss
різні
this
презентації
topic,
з
to
такою
hear
пріоритетною
different
актуальною темою, яку ми
presentations on
вважаємо
the priority relevant
важливою
topic
у
that
поточний
we
момент
think is
реагування в
important
Україні, але також і реформ, які
during the
відбуваються.
current response process
Власне,
in
перед тим, як
Ukraine
ми перейдемо
and
до
recovery process.
самої
Before we
зустрічі,
move
хотіла би
on to
наголосити на декількох
the agenda
основних
itself,
моментах.
I'd like to highlight
Перш
a
за
few
все,
organizational
просимо
points.
вас
First of all,
представитися у
we
чаті,
kindly ask you
написавши
to
своє
introduce
ім'я,
yourself
назву
in the
організації та
chat,
контактні
please,
дані,
with
щоб
your
колеги
name,
могли з вами
last name,
зв'язатися, але також, щоб ми могли
organization
занотувати
you
вам
represent,
протокол
and
як
contact
учасників.
information so that other
Також
colleagues would
нагадую, що в
contact
нас,
you and we would add
якщо
this
ви хочете
information to the
ставити
minutes of the
питання, можете
meeting.
писати його або в
Feel free
чаті,
to
або
ask
піднімати руку.
questions both in the chat
Просимо
or by
вас
raising your virtual
не
hand.
вмикати
Please
мікрофони
do not
без
unmute
потреби.
yourself
Також
if
просимо не
it's not needed.
використовувати
And also, please
інструмент
do not
телефонічного
use
тексту для ведення
artificial
результатів
intelligence
зустрічі,
tools
оскільки ми
for
ведемо свій власний
note
протокол,
taking because
а всіма
we have
матеріалами,
our
які в
own
нас
minutes of the meeting and we will share
які нас
all
демонструються
the
протягом зустрічі, вони
presentations,
будуть
slides, and other
безпосередньо після
materials with
засідання,
you
тобто ви
after
зможете
the
отримати
meeting.
доступ до всіх
So you
матеріалів і
will have
також
the
зможете
access
записати
to
до
the
зустрічі.
materials, the
І,
recording of the
звичайно, з
meeting,
нами
and the minutes of
працює
the meeting. And of course, we have
функція
the
перекладу
function of
синхронного, тобто ви можете
simultaneous
обрати
interpretation.
мову, якою вам
So feel free to
користуватися в
choose
сьогоднішній зустрічі.
the necessary
На панелі
language
Zoom ми
channel by clicking the
використовуємо
globe
оскільки на
icon
сьогодні
on the
спікерів
Zoom
як
panel because
англомовних,
today
так
we
і
will have
українських.
both English speaking
Пропоную нам
speakers and Ukrainian
розпочинати.
speakers.
І,
So
власне,
let's
темою
start.
сьогоднішнього
And
нашого
the
засідання
topic of our
є
meeting today
віддалені послуги з психічного
is
здоров'я та
remote
психосоціальної
services
підтримки. Це
on
такий
mental health
фокус
and
і певне
psychosocial support. This is the
розширення
focus
теми, яку ми мали
and
минулого
the
року, минулого року.
expansion of the
Якщо ви
topic which
пам'ятаєте,
we
тоді
had last
відвідали
year.
тоді
Last year
у
there
нас
was a
була зустріч
meeting
про
and
цифрові
we spoke
інструменти
about
в сфері психічного
digital
здоров'я. Зокрема, ми
tools
говорили про
in
штучний
mental
інтелект
health. In
та
particular, we spoke
віртуальна
about
реальність. Цього
artificial
разу ми
intelligence,
більше
virtual
зосередилися на
reality. This
питанні
time, we've
віддаленого
decided to
надання
focus
послуг,
on
тобто через
remote service
гарячі
provision
лінії, через
via
цифрові
hotlines,
інструменти, через
digital
заздалегідь
tools,
застосунки.
and other applications.
Оскільки,
Since
власне, це є те,
this
що, як ми
is
знаємо, дуже
something that
багато
we
організацій
know
впроваджують і
a lot of
розглядають в Україні,
organizations implement or
застосовують
plan
або
to
збираються
implement
застосовувати.
or
І, власне,
apply or
використання
are
таких
going to
віддалених
apply. So
інструментів,
the use of such
воно
remote tools
часто обговорюється в
very
контексті
often gets discussed
доступу
in the
до
context of
користувачів послуг,
access
доступу до
to
різних громад,
service
зокрема,
users, access to different
пошуку
communities, in
різних
particular
в
communities close to the front
питанні
line in
того, що не
Ukraine.
завжди ми,
And the
як
point
надавачі
that
послуг, зокрема
we
міжнародні
as service
організації, маємо
providers
можливість
and or not
приїхати
NGOs, we don't
до
always have a
користувачів
chance
послуг, не
to
завжди
come
можемо
to the
достатньо
service
довго
users. We don't
перебувати в тій чи іншій
always
громаді, щоб
have
надавати
the opportunity to
послугу
stay in the
довготривало. І тому,
communities long
власне,
term to provide
багато
long-term
організацій
services.
використовують,
So a
застосовують,
lot of
розглядають
organizations they
такі
use or
віддалені
consider
інструменти надання послуг.
remote tools for service
Тому,
provision.
власне, ми вирішили організувати таку
That's why
зустріч,
we've
де ми
decided to
обговоримо
organize
як
this meeting where we will
керівництва,
discuss
рекомендації,
different
також
guidelines,
тренди
recommendations,
з
current
глобального
trends
рівня, так і
on the
ті
global
кращі
level
практики в
and the
рамках
best
України для того, щоб ми
practices in
могли
Ukraine
обмінюватися цим
so
досвідом
that
і
we would have a
впроваджувати
chance to
ті всі
exchange
аспекти для
experience
себе.
and discuss everything with each
Власне,
other.
розпочати я
So
хотіла би з того, щоб
I'd like to start
надати
from
слово пані
giving the
Анні
floor
Соколенко,
to
яка
Anna
представляє
Sokolenko,
сьогодні Координаційний центр з
who
психічного здоров'я Кабінету
represents the
міністрів України, для
Coordination
того, щоб
Center for
поділитися з
Mental
нами
Health of the
тим,
Cabinet of
що наразі
Ministers of
робиться
Ukraine,
державою,
to
зокрема в
share
рамках
what's
впровадження всеукраїнської
the
програми ментального
government
здоров'я
doing
за
within All
ініціативи
Ukrainian Mental
першої
Health
леді
Program,
України
which is
Зеленської,
the initiative of the
і
First Lady of
поділитися такими
Ukraine, Olena
ключовими
Zelenska, and
наслідками тим,
she
що
will
може бути
share the
корисним
key
з
findings on what
національного
can be
рівня, і,
helpful
власне,
from the national
розповісти
level,
нам про
and
всі
she'll
ті
share
здобутки і продукти, які
all
є в
the
всеукраїнській
results
програмі
and
ментального здоров'я. Тож, пані
products
Анно,
in the
дякую,
All
що ви з
Ukrainian mental health program. So, Hannah, thank you. The floor is yours.
Дякую, пані Катерино. Вітаю
Thank you,
всіх присутніх.
Katerina.
Я
Hello,
спробую
everyone.
коротенько до
I'll
15
try to
хвилин
be brief
вкластися.
and
Скажіть мені, чи видно мій екран? Так.
like speak no more than 15 minutes. Can you see my screen?
Видно.
Yes, we can see your
Чи
screen.
гортається презентація?
And the slides change? Yes.
Супер.
Awesome.
Мене звати
So my
Соколенко
name
Анна,
is
я працюю в
Sokolenko
координаційному
Anna.
центрі
I work
психічного
for the
здоров'я
Coordination
Кабінету
Center
міністрів
for Mental
України.
Health of the Cabinet of
Сьогодні
Ministers
трошки
of
зупинюсь
Ukraine.
на віддалених
And
прикладах
today I will
послуг з психічного
tell you
здоров'я
about the
та
remote
психосоціальної
services on
підтримки.
mental health and psychosocial
Про
support.
актуальність трошечки
The
може
relevance of this
показати наша
topic
четверта хвиля соціологічного дослідження
is shown
в
in
межах
the fourth
всеукраїнської
wave of
програми ментального
sociological
здоров'я
research within All
Ми
Ukrainian mental
побачили,
health
що
program named How Are You?
більша частина
And we've
людей мають
seen
такі
that
бар'єри
most
звернення
people
за
face such
психологічною допомогою,
barriers
як
asking
те, що
for
можуть впоратися
psychological
самостійно,
aid,
і
such
не вважають
barriers.
свої
They
проблеми
think that they can
достатньо
cope with it by
зверненнями.
themselves
Однак
or
ми
their
бачимо
problem
доволі
are
високий
not big
відсоток,
enough
так,
to ask for
33
support. But
відсотки, що
quite
вважають
big
це дорого,
percentage,
є ті, кому зараз
33%,
ефективніше,
they find
24
that it's important,
і так далі.
23%
Тому
think that
тут
it's important right
питання
now, they need it.
налагодження
So
надання
here it's all
віддалених послуг
about
є вкрай
providing
актуальним, ми бачимо.
remote services,
Що
and
робимо
this
ми на
is very
національному
relevant. So
рівні?
what
І
is
я
it that we do
розкажу
on
тоді
the
як формат,
national
тому
level?
що ми
But I will
працюємо
tell you
на
about the
декількох
community
рівнях.
level because we work on a
Наша
few
філософія,
levels.
що ми
Our
змінюємо
philosophy is
систему
that we change
інноваційно, а
the
не
system
еволюційно.
by
І у нас
innovations, not
хаотично
waiting for
небагатоголосся,
evolution.
тобто ми
And
говоримо про
from
те, що
chaotic
наявність великої кількості послуг це не
multi-voice
дорівнює наявність
opinions,
системи.
I say that many services
Тому
does not
ми
equal the
маємо це все
presence of the system.
об'єднати
So
у
we
чіткі,
have to
зрозумілі
join all of that
рівні, рухи,
into
маршрути.
clearly
Що у нас зараз є?
understood levels and
Ми
roads and
реалізуємо
pathways. So
багаторівневу
what is it
систему
that we have
координації
right now? We
нашої
implement
програми
multi-level
на таких
coordination
рівнях,
system
як
of our
перший рівень
program.
це
The first
міністерство,
level is
центральний
the
орган
ministry and
виконавчий, чи
central
АДРА.
executive
Другий рівень
authorities.
обласні
The
військові
second level is
адміністрації,
the Oblast military
при яких у нас
administrations,
є
and
регіональні
in them we
координатори,
have the
23
regional
людини в
coordinators,
кожній області.
23
Я
people
впевнена, що
in each oblast.
ви
So
чудово їх всі знаєте.
there is a
І
person
ми запускаємо
and
вже другий рік, третій
you
рівень.
know
Це
well all of them.
консультанти
And
в
the third
громадах.
year
132
we're
людини у
launching
нас
one
вже
more
працюють
level,
в громадах самостійно
132 consultants working
налаштовані
in the
працювати
communities by
саме
themselves. They
організовувати
work
послуги з
and they
психічного здоров'я та
organize
психосоціальної
the
підтримки.
services on
І
mental
цього
health
року
and
також ви
psychosocial
будете
support. And this
почути
year,
консультанта з
we
кожної
will have
області.
4
Тобто ми
consultants
розширюємо
in
мережу,
each
і
oblast.
наша
So we will
основна
expand
задача
our
також
network, and our
розбудувати
main
сервіси на
task
рівні громад,
is to build the
але так
services
само
on
ми
the community
використовуємо
level.
і
Likewise,
інструменти
we use
роботи
the tools,
цифрові,
which
віддалені,
are
так, бо не всі
digital
громади
tools
можуть
for
створити
remote
центри
service provision,
психічного
because
здоров'я, і
not
не
in
у всіх
every
треба.
community we can create the
Із
mental
інсайта,
health
можливо,
centers, and it's not needed in
поділитися
every
своїми
community.
інсайтами.
And let me share my insights.
Ми стикнулися з тим, що в
We faced
віддалених,
the
ізольованих
situation that in
громадах
remote,
люди,
isolated
навіть якщо вони не
communities,
мають
people,
стигми,
even if they
звертаються
don't
за
face
психологічною
stigma,
допомогою.
they don't have
Місцеві
stigma to go and ask for psychological aid, the
місцеві психологи,
local
люди їм не довіряють,
psychologists
бо
are not
бояться, щоб
trusted because
вийшла
people,
інформація,
they
так,
are
про ці
scared that they
конфіденційність
will share
переживають.
this information, so they worry about
Так, видно мій
confidentiality.
слайд? Ага,
Can you see my
секундочку, він
slide?
виїжджає.
It is loading. Just a moment.
Видно вам?
Thank you for your patience. I hope you can see my slide. Yes, it is
Воно
still
завантажується,
loading.
так. Тут я просто хочу показати
Here, I'd like to
конкретно,
show you
що
the
було на кожному рівні.
specific information which shows what happened in each
Не
level.
видно, на жаль, да? Тільки
Unfortunately, you
ресурсний потреб.
cannot
Давайте тоді
see the
повернемось
slide,
до
only the
цих
audit
рівнів.
of resources and
Дивіться, на
needs.
рівні
Let me go back
міністерств у
to
нас
these
є
levels.
пріоритетні
On the
проекти
ministry level, we
міністерств.
have the
Ви про них
priority
знаєте,
projects
це,
of the
наприклад,
ministries. You
Державний
know
соціальний
about them. If
проект,
we speak
центри
about Ministry of
життєстійкості,
Social
які
Policy, it's
потім
Resilience
масштабувалися, так, на
Centers
всю
that
Україну.
scaled up to cover the
Якщо це
whole
мінімальний
country. If
спорт,
it's
це активні
Ministry
парки,
of Youth and
молодіжні
Sports
центри,
Activity Parks and youth
і так далі.
centers
Крім
and so
ветеранів,
on and so
наповнення
forth.
реєстру
Ministry
психологів,
of
надавачів
Veterans,
послуг з
that's the
психічного
Registry of
здоров'я.
Psychologists providing mental
Також
health
в цьому
services.
році
Also,
активно
this
працюють
year,
обласні військові
the Oblast
адміністрації зі
military
своїми проектними
administrations work
командами. Ми
actively with their
запустили
project
трек
teams, and we've
регіональних
launched the
пріоритетних
track on
проєктів. В кожній
regional
області він
priority
буде свій,
projects, and
так?
each
Він
oblast
буде
will have its own
направлений,
track.
він вже є,
And
але скоро
it's
ви з ним
already
будете
there, but
знайомитися.
very soon
Він
you
буде
will have a
направлений на
chance to
конкретні
learn
цільові
more. It'll be
аудиторії,
targeting
але
specific
водночас буде
target
забезпечено також
audiences,
секторальну
and
міжвідомчу
at the same
взаємодію,
time, the
тобто щоб у нас
intersectorial
на місцях теж
interagency
працювали
cooperation
спільно
will be ensured so that in the
соцзахист,
location, the
охорона
Ministry of
здоров'я,
Social
спорт,
Protection
культура,
health sector, sports, culture, all the sectors would cooperate and interact. And I think you cannot see this slide. Oh, finally it's loaded. So the priority projects of the ministries, all of that was built based on the audit of resources and needs of the target psychological aid model 2.0. And right now, based on the previous work results, we'll have the target model 2.3, and you'll hear more about it later. Well, that's the way our cycles look like, and that's what we focused on. Now, I was asked to briefly tell you about the possibility to organize remote services according to the recently passed law on mental health system in Ukraine. So in this law, in this part about remote services, we need to focus on Article 23 of the law, which is named Digital Services in Mental Health. We will be able to practically discuss how it works when the Cabinet of Ministers passes the order. What I mean, the National Commission on Mental Health requested the development of the order by the Cabinet of Ministers of Ukraine, which will regulate digital services in mental health. So, also last year, the National Action Plan for 2024-2026 was approved on the implementation of the concept of the development of mental health until 2030 in Ukraine. And it is said that there are specific events and measures for 2024-2026. It is an open access and on Zakon.ua, and you can see what your ministries are doing, what's the responsibility of the communities, what will do this year, next year in terms of operational plan and strategic by 2030 within the context of the past law. Now, the community consultants. For sure, you've heard about regional consultants, but in the communities, we have 132 consultants already working. They organize joint action days, and you've seen that they were mapping all the services on mental health and psychosocial support. On the local websites, you can see the guidebooks and the service pathways in 132 communities, and the course Resilience of Community was taken. Both the consultants and the representatives of local authorities took this course to know where to refer people, to what services people can be referred from their location. And the guidebooks look this way. You can find them on the community websites and on the websites of Oblast military administrations. That's mental health service pathways. Here is the example of Volynski guidebook, but it's available both in the digital and paper formats. Now about remote services. Our web page, which started as a communication page of the program How Are You? It transformed into a modern online platform where you can see the hotlines, numbers, and different applications and mental health service providers for different population groups. What's really important and what we do highlight is that every single month we verify all mental health service providers that are on the landed platform How Are You? So feel free to use howareyou.com for an updated information. Also on How Are You platform, we have the webinars, the community resilience, that's the heads of services and organizations. They can take this webinars, and also for the workers of economy, culture, and education sectors can take the cycle of webinars for resilience and to counter burnout. And on the landing platform, we also have the information how to help children with anxiety. All people can take this webinar online. You don't need to pay for it or register for it. And we recommend you to use the self-help first aid kit, which is always helpful and has specific exercises so that you'd be able to help yourself in the times of stress and anxiety that sometimes we all have. And also, I'd like to say a bit more. I understand I have a little bit of time about veterans. I will simply show you that we have the communication campaign on the veterans' experience that they deserve dignity, and a separate part of barrier-free book. There is a part about veteran policy and a separate manual for trainers. The manual for trainers, how to communicate and work with veterans, and also educational TV series. And to simplify and overcome stigma, we have the interaction in illustrations with the help of clear to understand scenarios and descriptions. And the new thing that was launched this year, we will speak about it today, with the support of the Program of Medical Guarantees, and the National Health Service of Ukraine has already signed the contracts with 129 mental health centers. And over there, apart from psychosocial and psychiatric care, they also, in the outpatient form, they also provide such services by mobile multidisciplinary teams. Following this QR code, you can see the full list of services that are provided by this package in 129 centers. And lastly, let me share my practical implementation of work of the spaces of psychological support in the communities. We organized these spaces. In general, we organized 32 of them with donors' support. Unfortunately, in February, we lost this support in February this year, but let me share methodological recommendations with you. Maybe you will launch this in your communities. The point is, in the confidentiality rooms, thanks to digital technologies and solutions, we provided psychological consultations, counseling online for remote deoccupied territories. It doesn't cost much, but it proved to be very effective. So the concept of the spaces of psychological support and methodological recommendations can be found by scanning this QR code. Feel free to open howareyou.com and you'll see a big list of mental health service providers online, and also follow the social medias. How are you, and what we do as a coordination center for mental health of the Cabinet of Ministers of Ukraine. Thank you for your attention. Thank you so much, Anna. Feel free to
Ще ні.
ask questions. So, have I stopped sharing the screen? Yeah.
Дякую велике, пані Анно.
Thank you so much, Anna. Colleagues, do you have any questions? Maybe you'd like to clarify something.
Ніби немає.
It seems like you have no questions. Okay, Julia. I want to thank Anna for such interesting presentation. And when you share materials and methodological recommendations and courses, and when you make these materials really available for people, service users all over Ukraine. And it's interesting to know if you track the users number, and if so, does it increase? Are there any trends on the demand on the materials and courses? Yes, thank you. You really track not only the coverage by our networks, but also we collect the number of requests on hotlines to see the trends, to support what's needed. Actually, traditionally, in the periods, I mean, in such active information campaigns of the enemy, people have higher stress and need to call the hotlines. And over there, they can get crisis psychological aid, psychological first aid, and we can see that the resources I named, the self-help first aid kit, they are very popular and they are in demand. And also our materials on how to work with children are very popular. That's why These are the most requested materials. If you need specific numbers, I have the analytical table, Excel table. I can share it with you because we can see the increase in demand because it's very relevant right now because we do nothing for people without people. Thank you for the question.
Дякую, пані Анна, дякую, пані Юлія, за запитання.
Thank you, Anna. Thank you, Julia, for the question. And Kirom, there is a question from you.
Anna, thank you very much for such a wonderful presentation, and it's quite informative. And I'm sorry because it's the first time from my side to be part of this thing, and I got like kind of comments and also at the same time a couple of questions. It would be good to find out around these aspects, what is happening right now. As you mentioned already, that it's the funding was cut, right? And it's people actually were trained, and the number of centers with whom you're actually coordinating, it's around 129 across the Ukraine. And what would be the urgent demand for the current after the cutting the fund in terms of the building capacity or complementing the activities, what is already in the process? Because as you already mentioned, that we are facing more and more returnees and veterans and other aspects also with those individuals who is the war disabled. I mean, with the mental, it will be high demand in the future. And what is the preparation for that and how to cover these aspects? And the second question, as you mentioned about the law, that I was wondering, because from my experience when I was in Dnipro and in Kharkiv, just during the evening, you know, I was in a couple of cafes, and then I saw the group of women sitting with the lady and who is actually working with the kind of Torah numerology, kind of providing psychological support, this kind of type. And then I tried to Google online, which is quite popular across Ukraine. And also I tried to see how in this digital platform actually promoted all the services which is provided by the Humanitarian organization and NGO across Ukraine. And then I got this double doubt because these ladies and who is doing the online consultation, psychological support, coaching, I don't know, it's using the cards, numerology, trying to navigate people, supporting their mental stability. They are well promoted online rather than our services there. And as you mentioned about the law, is there any kind of movement towards to involve this huge army of the online psychologists who is earning money? I don't know if they are certified for that, if there any way to I don't know, to control these kind of things additional to that, because I'm 100% sure that it's 130 people, as you mentioned, as a consultant across the country. It's not enough because Ukraine is a huge country. And it will be like the demand for that services is quite big. That's why I'm not expert in that field, but from my programmatic part, to plan all this intervention would be good to know this aspect. Thank you very much.
Я перепрошую, якщо можна, то я тут трошечки прокоментую.
If I may I comment a little bit. Thank you for the question. So the first part, the slide which you showed me, it was about donor project 32 spaces of psychological support. They are partly funded by the local budget, partly funded by other donors. So it's like an option for the remote communities. This is the tool that we wanted to share with colleagues because like there are almost 70 participants here. Other 132 mental health centers, this is the part of the program of medical guarantees in Ukraine, and there is a separate package of program of medical guarantees paid by the National Health Service in Ukraine, and it is fully built into our service system. This is something that the state guarantees. There are 129 centers right now based on the cluster hospitals and other hospitals. At the same time, they can provide remote services. I mean, small communities can contact these centers, and likewise, following this cascade, they can get the online services and connect the clients with the community specialists. So that was the priority project of the ministry within All Ukrainian Mental Health Program, and ended up as a ready product that we use. Like all the family doctors took MH gap course by the WHO, and all of them can provide mental health services on the primary healthcare level. I mean, it's already stipulated by the legislation of Ukraine. And the second question, recently we discussed with the management, but in terms of tarot and numerology and coaches, this point of discussion, this trend is very high, but I don't think that it's just about Ukraine. It is the global trend, this magic thinking, So to avoid getting into non-specialists of mental health or to people who have no right to provide psychological consultations, counseling, psychotherapeutical aid. That's exactly why our president, I don't remember the date precisely, but late January 2025, signed the law on mental health system in Ukraine. According to this law on mental health, this year, finally, for the first time in the history of Ukraine, we will organize the National Commission on Mental Health, which will verify psychologists, certify psychologists. I mean, there will be specific requirements to psychologists and their competencies, qualification, education, and to the area of their activity. Roughly, the psychologists in the education sector will not work with veterans. That's a rough example. So finally, for the first time this year, the psychological service market, mental health service market will be standardized, verified, so that, as you could see it in Kharkiv, numerologists would not be able to use that. And what is it that we do on the national level? We run the communication campaign and we explain that. What is psychological aid? What is mental health support? We work towards regulation, and when there is the registry of psychologists, the person will choose to go to a tarologist, numerologist, or a qualified psychologist, because we cannot limit people in their choice, because we're Ukrainians. Anna, may I interrupt you? If I may, let's explain all these questions to Kiram bilaterally, because I understand that they are not too much relevant to the topic of this discussion. The questions and comments are very important, but we need to provide more context to explain everything and to answer the questions. So we will partly answer your questions in the chat and partly will answer bilaterally, because I understand, Anna, that you also have a lot of points in your agenda, and we have other speakers who are also in a hurry. So let's not dive deep into this discussion, because there are a lot of different points in Ukraine, and in Ukraine we have a complex system thanks to the mental health system and coordination center for mental health of the Cabinet of Ministers of Ukraine. We have coordinators, consultants, centers of mental health, and a lot of other things which need to be explained. So we will work on this and answer you bilaterally. So if you have questions like that, colleagues, please put the email of the technical working group in the chat. And if you want to learn more, if you need more information, please feel free to contact us, and we will gladly offer you more information and share everything with you, because this is one of our main functions in our activity. And right now, Anna, thank you so much. I want to thank the Coordination Center for the ongoing support of our work and discussions. And let's move on to our next speaker, who will tell us about the roadmap on digital services in mental health that is being implemented and developed by the European region of the World Health Organization So, the floor is yours. Thank you.
Tijerino, and I am the second Anna in the program. So I'm Ana Maria Tijerino. I'm a technical officer working for the WHO Regional Office for Europe. I am based in Copenhagen, and it's a real pleasure to be here with all of you today and see you in such a high number of attendance. So I'm very pleased to see this, and I know it's a huge coordination group. This is why I'm even more pleased to be able to be with you today. I have a very small slot to guide you on what we are doing. So Katerina just introduced that we are currently under the development of a roadmap to implement digital mental health tools. And it's a roadmap that should speak to the all 53 member states of the European region. So I will go very few slides because I don't want to take too much time, but only a few slides. So you can see, so you could understand a little bit more what we are doing, but also I will be very pleased to, if you have questions, to answer them at any point. Apologies, I'm just going to find, yes, I have too many screens open. I hope you're able to see it now. Are you able to see it on a presentation mode?
Yes.
Not yet on presentation mode, very likely. It's better now or not?
Так, все бачимо.
Yes, perfect. Thank you.
Oh, thank you. Good. Apologies. I will just go for the beginning. Great. So please interrupt me because I don't see you on my screen right now. So please interrupt me if you have any question or if you need me to stop. So I'm going to guide you through what we are doing right now within the mental health flagship team. And this is one of the products that have been requested by the members of the Pan-European Mental Health Coalition, but also because it responds to the two flagships that we are still developing under the current European program of work, which is the digital health flagship and also the mental health flagship. So the roadmap actually, starting drafting this roadmap started in 2023 in a very big meeting where we were discussing together with not only mental health colleagues, but also colleagues from the digital health field. What is this future of the health systems around digitalization? But also the roadmap needs to be aligned with the regional digital health action plan for the WHO European region that was approved in one of our regional committees assemblies and is approved for 2023 until 2030. And why do we need a roadmap for digital mental health if we already have a regional digital health action plan? So, because we know that for some people, especially for mental health specialists and mental health within policy making positions, we need to also try to translate this language of the digital health to how to implement in these nuances that mental health tools, interventions, but also specific challenges might have. So the idea is actually to be able, through this roadmap, using these 5 guiding principles from the digital health action plan, to be able to translate it for mental health policymakers, but also for people who are trying to implement digital mental health tools. And what are those 5 principles? So we need to place always the individual at the center of care, and that means also to safeguard what we are offering in terms of evidence base, but also highlighting the principle of do not harm. The other principle is that we need to understand what are those health system challenges and including those health needs and trends. And I think the previous Anna already highlighted how in your country you're trying also to adapt to those current trends and needs. It needs to be based on evidence and in lessons learned. I think this is something in WHO, as you might be very aware, we promote, encourage, and we defend. Because today we're in a place where things happen so fast and sometimes difficult to catch up what's going on in terms of development of new technologies, but we need to base that on the evidence. And because we want to use digital transformation to bring that future of health systems and to strengthen those health systems, but also to reduce the gap on accessing health services. And of course, the last principle, it's how we need to commit to the long term of this integrated care approach that should not be as all in a silo. So this roadmap that we are right now under, it has been 2 consultations. I will show you the next one, a slide on how is the methodology, but why we want to do it, because we want to enable policy alignment. We want to have this system-wide planning and to build these resilient health systems, but also because we want to support countries and regional priorities, providing a common framework of action and how to implement what are those strategic areas that we need to not only to care and to be able to implement, but also that doesn't matter in which level of implementation of digital technologies a member state might be, but this common framework could help on where we should aim. What is the final outcome that we want to aim all together? And also because we want to promote interoperability in between the different health policies and systems to provide equity, but also that is sustainable. And we want to ensure that in the digital mental health roadmap protects also human rights, which includes data privacy, informed consent, but something that service users commonly ask, because they are part of this consultation, is that it needs to promote trust. Service user needs to trust the system and needs to be the process as transparent as possible. And of course, that supports these scalable evidence-based interventions in different contexts. And quickly, an overview on the methodology. We have identified which were those strategic areas and which were the gaps in those areas that happened in Porto meeting in 23. We have, together with the Ministry of Health of Ireland, we are and representative from key member states, WHO collaborating centers, which is our academia and our centers of expertise, but also with organizations representing people of lived experience. We have been doing already 2 consultations online, but also with multiple exchanges on written and bilateral discussions on what are these core elements that I will show you in the next slides that the roadmap should contain. And then we plan to have a wider consultation in July with members of the WHO Pan-European Mental Health Coalition, but also with WHO Health Information Network and its subgroup on digitalization and innovation. And finally, we expect to publish or at least have ready the product by October this year. So what are those standards that we identified 5 of them in Porto, and now it became 7 through the consultations with our key member states in the core group. So these are the ones that we found that are more relevant in terms of how we can build the blocks to ensure evidence-based, but also quality implementation of digital mental health tools. So first, it's the governance and the implementation. We want also to highlight which are those standards and regulation. This is something that the service providers are asking tremendously, that we need to reinforce that regulation on the use of digital tools. Technology, infrastructure, and data will be part of the roadmap. It's not only the intervention itself, but also what is the behind engineering infrastructure that is needed to implement the digital mental health tools. The standard on research, evaluation, and innovation as a constant, not only at the end, but also as in every moment of the implementation of the tool. Considerations on culture, capacity skills by service providers and service users, but also how communication need to be one or something that needs to be strengthened. And finally, the networking and knowledge exchange, which member states have requested as an element that needs to be integrated. And from these standards, we also have draft some member states, service users, and our WHO collaborating centers have highlighted as those principles that need to be part of the roadmap, which is the collaboration, co-design, co-production, and co-creation, and including, as I mentioned, it was already in the principles of the digital health implementation plan for the WHO region, but people with lived experience need to be there at the center. And service users needs to have knowledge of what is not only knowledge, but be part of this co-design and co-production. It needs to be integrated and has multiple dimensions and align with other health policies within the country, so not to sit aside. Needs to have as a principle that all these interventions need to consider accessibility and equity that reaches everyone. And something that has been requested as a principle to be highlighted and probably should be also even included as a second is the choice and personal preference needs to be always there. And this is where also is linked to this balance of the human and technology aspect. So it's the service user, the user at the end, who has actually that choice of if they want to use or not this intervention, how they will prefer it, and that we always consider this balance between the human and technology aspect. And finally, because I just wanted to show you also very briefly a recent policy brief that was published, I think 2 weeks ago, and you can easily look for it on internet, and I will include it on the chat. It's addressing the digital determinants of youth mental health and well-being, and this is something that we have done together with the Ministry of Health of Poland under the Polish president of the European Union Council. And it was also supported by the DTH Lab in Germany, and it brings 8 priorities for policy action to support member states to understand and address impacts associated with social media and digital technologies in young people. And this is it from me, because what we wanted is actually to give you just a brief. I have stopped sharing now. Wait 1 second. Yes, we wanted just to give you a brief update of what is the current developments at the regional office. And of course, when this work has been finalized, we will share it with the country office in Ukraine, and they will be able to disseminate it with all of you. Thank you very much for this space, Katerina, and I'm staying here in case there's any questions or comments for a few more minutes, and then I will have to join for another meeting. Apologies for that.
Дякую дуже за таку
So
змістовну
thank you so much for
презентацію,
such a profound presentation and for such an important initiative on
власне, якось узгоджувати
just
та
to align
допомагати,
and help
сприяти тому, щоб
to aid in the process so that this service, the digital services and the mental health services would be provided in quality and easy to use for the users. Anna, I would just like to ask you, like, the fact that in Ukraine, we have like an expectation that all the changes are supposed to happen really, really fast. And we have like a lot of requirements to ourselves that what is the tempo of development of digital services, of digitalization and whatnot. And therefore, I would just like to ask you, like, do you think, are there any works done so far, maybe recommendations or best practices that you would have shared from your side as well in the context of how to balance in the framework of services provision, this wish or this thing to provide as soon as possible to digital services as soon as possible, and also in the need for those services to be high quality, it would not be provided or not be doing any harm to end users. Thank you.
That's a question, Katerina. I don't think I'm able to give you a time frame specifically because that depends of every context. And as I said, we have put in the roadmap considerations of those standards. So you see there are different boxes that needs to be there to be able to implement these tools and these supportive tools to increase access in mental health. So of course, I know that the time is pressure sometimes, and we are in a hurry of developing tools to respond to people's needs. But at the same time, we are highlighting that there is a number of areas that needs to be considered. So in the terms of legislative aspects on the part of what are the governments of this implementation, where is going to be seated, what is those minimum standards, even if it is a pilot or an innovative implementation tool, what can we do actually to ensure that is evidence-based, that ensures accessibility and ensures equity for everyone. So I think sometimes because we are living in those moments and where everything is needs to happen tomorrow, and we have everything at the reach of a cell phone, and all our answers might be there, but it's the moment where we also need to consider all these other aspects that are making the intervention safer for people, but also, as I said, something that its service users are asking a lot, that they want to trust in those interventions. There's so much offer available today, and things are developing all the time, but do we know what of those things are actually evidence-based? Which ones of those are actually able to provide evidence of doing no harm and improving symptoms or improving access to services? And I think this is where I'm not giving you probably an answer, but I'm saying that we don't need to compromise safety against the hurry of creating those tools.
Дякую велике, пані Анна, за
Thank you so much, Anna, for such a highlight. And it's an important aspect that you're also trying to put your attention to both in Ukraine and the framework of our working group, because this was one of the key, I guess, lessons learned from our previous discussion about AI or virtual reality, and the fact that, oh, we need to have those approaches. But from our one side, it's with caution, approach with caution, but also to take into account all the possible risks, all the possible things, and so that those instruments can be useful or easy to use and to bring you so much of access to services. We still have to or need to have at our attention that we might have like harmful practices or risks. And so here we will be able to listen to another presentation of different organizations that are providing services in digital format, where we will be able to hear out those risks and complexities that people might face if they are to use such an instrument, and also how to fight those complexities. Therefore, thank you so much, Anna, for being here, and thank you so much for joining us. And I'm hopeful that you'll also be able to hear the updates on the development of the roadmap and also on its launch and implementation. Thank you so much for being there and joining us in this meeting. And now I would propose for all of us to move along the agenda. And now I would just like to pass the floor to Anna Matvienko, who represents the organization in ADRA, Ukraine, so that she can share with us the results of services provision on mental health and psychosocial support in the remote format, is one of the organizations that were implementing these kinds of services and have such a vast experience in services provision in such a remote format within the mental health and psychosocial support. Anna, thank you so much for joining us here. Greetings, dear colleagues. Can you tell me, do you see my screen well? And I'm opening my screen. You can also make a wish because I'm a third Anna today. Therefore, maybe it's make a wish kind of Anna. So yes, we can see the whole screen. Okay, now we don't see the whole screen. So maybe I first like to share what is ADRA. That from the 1956 are working throughout the world. We are an economic partner or an economic body under the Social Board of UN. In Ukraine, ADRA is working from 1993, and from the period of establishment till today, overall, the humanitarian support and care of different kinds have been provided by 22 million people have received, and 3,200,000 people have received the And from the period of the full-scale invasion, and 55,000 people have received the mental health support, and out of them, 18,000, just a bit more than 18,000, have received the support in the remote format or teleformat. The biggest partner of our organization that aided in our provision of the support, and this is the Japan platform and ADRA Japan. And so from the beginning of the full-scale invasion, so the matter came to be that there is a big number of cities that are either at the front line, they cannot take psychologists in. So this was also from the safety point that psychologists can't actually be there. Also from the point that the city itself was in the area where you can't really get as a humanitarian organization, or you can only get to the humanitarian organization only if you follow like specific conditions, whatnot. Therefore, we have developed like for us a quality view tool to support these people when we were giving the humanitarian kits or evacuation pathways. There was a brochure that you can get remote mental health support, and so there they would have all the formats listed. So we have like a certain structure, and we would like to share it with you. As of today, we have a hotline for mental health support that has 16 operators working. This is all trained psychologists, and they have psychotherapist certificate. They have a crisis consultation. The calls are being taken. The only thing is that we didn't take to the level to take the calls 24/7. Therefore, we taken from 7 to 21 in the 21st in the evening or 9 in the evening. We take the calls from any part in Ukraine. The whole session goes for half an hour, but then we can continue it for 15 to 45 minutes. And within those sessions, we provide more of the crisis kind of support to stabilize their emotional state of health. And so if the person is lacking, they feel like it's not enough, then the person can be referred to our psychologist for an individual session or to the support groups or any kind of other formats of the group work, also in the remote format or teleformat. We have a number of partnership clinic, which is the one of the clinic in Oxford Medical Clinic that we have a contract with that are taking in people if there is a need in this specialized care to a psychiatrist or anything else in an online format. We also have a support chat. It's working 24/7, however, whenever you like. And to get access to, you just need to use Healthy 360 and to press the button that we need an urgent support. And on this slide, I've presented all the possible options to get in there. So there's Facebook, Instagram, Viber, and also in any kind of messengers or in the chats, the person can get their line of support and to also to write like to ask a question or went through a psychological screening or to get like a piece of advice. Then if they're not ready to speak on the phone, we have online sessions. And so as I mentioned before, when a person is just lacking one session, then by thinking to that web page, they can pick a psychologist, and in the center of the picture, we have 16 psychologists who have their own timeline. Person goes in, they select a psychologist, and they're speaking with the psychologist for the future session. Or any kind of support groups, apart from regular support groups, what we have a support group called the volunteering support groups for partners who are in a different type of remote support, which is for people who don't have either stable access to internet or they don't have the capacity, they don't have the phone or anything that you would be able to connect or not ready to speak on the phone. They just want to see a psychologist, and those groups are also there for volunteers as well. Online support groups for remote areas, which is the people and the remote people, local communities, versus the pilot community was the Kupiansk community. And so there we've given humanitarian packs, and there by our partner has been the library employee that has created a point of entry in the library to our system. And so it was prepared by the volunteers. So our employees, trainers, psychologists, and whatnot conducted with her a training session on like how do you act with people who are in psycho-emotional or requires support. They developed an instruction for them, like or templates of what to do, and they have become our facilitators on safety protection centers, so what we call them, or points of entry into our system. So as of now these volunteers are 26 in numbers, and some of them are volunteers, some of them just employees of this administrative center, some of them are the employees of the library, most of the school employees, and 10 people overall. And so in remote places, we are having specific places so you can join online to them. So here we are so grateful to the president program when the libraries was given computers, and because they have a stable internet connection, if the blackouts are there is a generator, so a person can always join in from that point onwards. For the local inhabitants, which is our volunteers, and they are coordinating the scheduling. If it's a group session, that they're putting into the group session according to the groups of people or topics that are happening with the support of our psychologists, or they're asking them to join individual sessions through the web page, and also they're booking a place for a person. There are methodological recommendations developed for them. There's protocols for things to be conducted. This is also referred because the group activities are also conducted in the format when the psychologist is developing like a group line of work or like a training, and the facilitator is also aiding so that everybody can join and everybody could participate in this line of work. We're also doing regular supervisions for our volunteers and for them not to get too tired and to track their mental status. What we have is the new thing for us. So we have developed a platform for the support and rehabilitation for the veterans of people who have suffered from explosive trauma, and people with disability, which was a structured service that would allow us to the beneficiary and everybody else to work in the dynamic. And so the person can just get into the web page to select a psychologist to them. And so there is a specific categories, and to receive their like a checklist in the session, like home tasks, and through the web page they get the diary of self-observation they can get on the phone or anywhere, or in the Viber or in Telegram. If the person does not have the specialized equipment, then in those partnership points, then our expert, the person that is our volunteer, just bringing out, and then they're giving them this self-care diary or the techniques diary, where a person just notes everything down and can work for the support of the quality of those remote services. We have a web monitoring system. There is also a Google form, which is simpler for people to whom it's harder to work in online format. And there's also an online form of quality assessment, when in the form itself you can leave like a feedback, and so then all this data has been integrated into the internal CRM system so that you would be able to track the services provision quality for psychosocial services. So what was there? What are the lessons that we did during the line of work of provision of those remote services? So the first lesson that we got, that you can't have unstable internet connection. So technically you have to be ready. So you might have the internet being off or the electricity is being off, and so if there is a blackout, and so after that, the psychologists that worked in specifically in individual practice, they have to wait for a few minutes when the person will get back connected using like an expert or something. This can also add into the fact that the person is losing either the point of consultation or their emotional state is actually getting worse, not better. Therefore, before we start the session, we are doing the preliminary technical screening. So we are asking the beneficiary, do you have access to a stable internet connection? Do you know how to use a smartphone or a computer? And do you have a private space to participate in the session where it's an unstable internet connection or there's no electricity, for example? Our remote access points are working, so then we are providing the ability for them to join in there. If the person doesn't have ability to join in at home, or we are providing the phone alternative, so just like a phone call is an alternative. So the second way forward, which is the unreadiness of the beneficiaries to the online interaction, there is a part of people of advanced stage, they have complexities with trust, specifically to an online format. They're afraid that, their data is going to be somewhere, or that overall they're just mistrusting any kind of innovation that might be there. Therefore, we are making short instructions. Here, our local volunteers are helping us a lot, because if those are the people, if this is small villages and those are the people, they have trust in their local digital place of residence. They're explaining why do they need that for, and so what are the things that people are getting and what kind of concerns do we have, or so that their information would not get anywhere unless they wanted to. And if this person wants to join in, we're asking like, oh, do you want for a local volunteer to be there with you? Or in cases like if there is a need or anything, can help you with this interaction to be stabilized or stable. So that the people to preserve their psycho-emotional state. We have ethics protocols functioning. The screens out of them, you can see from the bottom of the page. They're helping us in the development of the correct way so that you can work correctly online. And so they are stabilized for the work in the digital format. And so we are also using all the possible means necessary so that information from the client would be stored. We have our own webpage with the censored platform. We are not having any emails and any other social media and anything open, not encrypted, because we have our own encryption. So if we are speaking about the Telegram or Viber, this is only primary consultation, and then the person is being moved into the encrypted platform on the web page. We have our own CRM system that's also coding the data of the client, and so we are trying to follow all the laws on mental health system that started to be active in 2024. And because of our ability to adapt, ADRA is working in 16 oblasts of Ukraine, starting out of 24. And we have a list of government awards, for example, like the volunteers. We are in the part of the Forbes journal, and so on the volunteering market. And so this mapping of our services was in the Ukraine. And also, I would like to finish my presentation with this following phrase, that the telework, it's not a compromise. Sometimes it's the only opportunity so that the people who would need the support would be able to get it. And so in the right bottom part, you can see the QR code where you can see or get together with the activity of ADRA as a journal and ADRA for the whole period of work. Thank you so much for your attention. Oh, thank you so much, dear Anna. It's such an interesting piece of information and such a big coverage of your activity. You have so many interesting recommendations and lessons learned. I think colleagues would also feel like it's interesting for them to look at it in the format of if you have the mailing or the materials or anything else. And I know that you're on your way, so I'm not going to take more of your time with questions or something, but together with that, if the colleagues will have questions, then we will pass them on to you and we'll get in contact with you as much as possible, because we know that how interested people are. Thank you so much, Anna. And I would propose for all us to move along the way the agenda. And now I'd just like to pass the floor to Georgia from the International Medical Corps so that you share this information on the recommendation in International Medical Corps in terms of provision and the remote services. Thank you so much, Georgia, for being here with us, and the floor is yours.
Thank you. Thank you all. I hope you can hear me well, because I have some problems with my internet actually today, even though we are talking about digital world. And I'm very, very happy to be here today with you, and honored to have this opportunity to present to you and to walk you through the development of our IMC remote MHPSS guidelines. Briefly, I want to introduce myself. My name is Georgia Karoutzou. I am from Greece, and I am a psychiatrist as a background, and I am working with IMC since 2021 as a global MHPSS advisor. I had the pleasure and the honor to support Ukraine the first years that I was working with IMC, and I have visited Kyiv, and I am really, really very happy to be here today. So regarding the topic of my presentation, I would like to discuss with you today how these remote MHPSS program guidelines came about, who they are for, and how we developed them. Next slide, please. To begin with the purpose and the rationale, There has been long gap in comprehensive global guidance on delivering MHPSS in geographically remote, low resource or inaccessible settings, especially in humanitarian contexts. And being an advisor that I am supporting programs in diverse, I would say, portfolio where we work for Sudan, South Sudan, Somalia, Afghanistan, Pakistan, Libya. So you understand that we are talking about diverse countries, that the needs for MHPSS are huge, and quite often it's quite challenging to access the people in need with our services and our programs. Usually these contexts that we work in involve security risks, conflict, limited access, natural disasters, minimal connectivity as well. We work in countries that we don't have mobile, landlines, or even internet, or the vast majority of our beneficiaries won't have access to those resources. The COVID-19 pandemic brought additional complexity. So we had movement restrictions, we had infection control measures that made in-person, face-to-face MHPSS services difficult or even impossible, depending on the countries and the measurements that they took at the initial stages of the pandemic. And this underscored the need to move to a remote approach to see how we can adapt our programs and to see how we can continue supporting our existing clients, but also how we can access and reach to new ones with safe and I would say quality services. Beyond the pandemic, we have seen increasing openness to remote or even hybrid MHPSS models for a variety of practical reasons, making these guidelines, I believe, relevant in the long term. Now I would like to discuss a little bit on who the guidelines are for. And the guidelines are primarily intended for MHPSS staff and providers, service providers in humanitarian settings. These include technical teams at HQ level, at country level, country leadership, field program managers, frontline workers. They may also be useful for government partners and donors that they are interested in ensuring safe and accessible MHPSS programming. Very quickly, I want to walk you through the process of these guidelines and how we developed them. So back in March 2020, we initiated consultations with country teams to understand immediate needs. It was the first phase of the pandemic. And based on that, the needs were quite, I would say urgent. There was an initial draft of the guidelines that was released in April 2020. But of course, we wanted to move further from there, and we wanted to provide, I would say, evidence-based guidelines to understand from the colleagues that they were implementing remote services, what are the best practices, what are barriers, what are their recommendations. And we decided to use, I would say, this as a learning opportunity. And we conducted a global case study across 5 countries. Can you please press one more button? Thank you. So it was actually at the time that I joined IMC, and I still recall these initial days where we picked up 5 countries. It was Venezuela, Libya, Iraq, Central African Republic, and South Sudan. And we wanted to have a diverse portfolio of these countries with different, I would say, needs and capacities to better understand how remote MHPSS was being implemented in these settings. and in these countries. It was a long process of data collection, and I would say it was quite challenging even for because of the pandemic and the movement and traveling restrictions and everything. We managed to conduct over 220 key informal interviews. We included in this case study interviews, and we got feedback and information from our staff from different levels, not MHPSS staff, but from leadership. We also engaged with community members, with our clients, with caregivers, with other partners that they were working on the field. And these insights help us identify lessons learned and best practices across these quite different contexts. The findings of this case study were published in November 21, and we quickly, realized that it was something that it didn't end there, but we needed to revise and expand the already existing guidelines. And I do recall, because I was one of the people that we conducted the interviews, that everybody was asking about training and materials and the need, to capacitate ourselves and our programs and our communities on remote MHPSS. Once we worked on revising these guidelines with input from our country colleagues, HQ technical staff, we had also an external technical advisory group from colleagues around the globe with different agencies and organizations that they offered their valuable feedback and inputs on these guidelines. And we then developed the updated version of our guidelines, and we moved ahead with piloting those guidelines in Jordan and Venezuela. So these pilots allowed us to get further input, and we refined our guidelines additionally. Once we had the final version of our guidelines, we translated them into Arabic, French, and Spanish, and we also created on our website in International Medical Corps on MHPSS page the digital version of the guidelines. Can you please move to the next slide? This is the cover page of our PDF version of document of the guidelines, which you can find on our website, and we will share the link to that on the chat. And you will find also the translated versions, but it's also the version, as I told you, on the website, that you can easily navigate it, and it's friendly. It's quite friendly to use. Next slide, please. So here I want to show you, I would say, the structure, the skeleton of our guidelines. You will see, and perhaps this will be familiar to some of you, it follows the IMC integration toolkit that we have. And so we have 3 steps. Step 1 is anticipate, need, assess, and plan for remote MHPSS programming. Step 2, it's prepare for remote services, and step 3 is implement. And we have these cross-cutting elements, as you can see, that actually are relevant for each of the 3 steps. Each step includes the what, why, when, who, and how of this phase of the phase, and there are also clear sub-steps to support work planning and task delegation. We also have in each step references to tools And we also have practical tips and field experiences. There is a high-level checklist and key considerations. And of course, we also have hyperlinks on external resources that provide links to guidance relevant to implementing the step. The cross-cutting components like the ethics, the capacity building, M&E, and staff well-being and self-care are integrated, as I said, throughout the 3 steps, and they should be referenced at each stage and by all stakeholders. These guidelines are flexible. They can be used from the design phase of a new program, but they can also be used during implementation or even when adapting an existing in-person MHPSS program to remote or a hybrid model. You can see also on this slide the link to the web version of the guidelines. I would really like to invite you to go there and navigate, to check it. And it's quite, as I said, user-friendly. We have each step, and we have also a webinar for that you can listen to and you can watch, and it has a demo on how you can go in different sections of the web version. And we also have there the training manual for remote MHPSS programming, because as I have said in the beginning, it was one of the main, I would say, needs that we identified during the case study, but also afterwards when the guidelines were published. So, in summary, these guidelines emerged from an urgent operational need, informed by field realities, strengthened through consultation and field testing. We did our pilots, as I have shared, and structured to be practical and for a wide range of users. Next slide, please. This is a slide. I will not go through that because of the time sensitivity. I don't want to keep you longer, but here are the main recommendations that came out in this case study that we conducted, and which led to the revision and the development of our guidelines. And I encourage you to have a look into that global case study report. It is on our website as well, and you can easily find it. And it contains valuable insights for practitioners navigating in, implementing, designing, and preparing for remote MHPSS programming. Thank you all for your attention, and I hope that this was a brief, I would say, introduction to our guidelines, and we are happy to hear from you your feedback, your recommendations, and how you're going to use those, if you're going to use them, which we believe it would be, essential if you're working for remote services. Thank you.
Дуже дякуємо, Джорджія.
Thank you so much, Georgia. I know that really these recommendations are so important, and they were developing very rapidly in COVID conditions, but they are still relevant here in Ukraine for us. Thank you so much for taking your time to join us today and sharing these guidelines with us. And we will share all the feedback with you from all the colleagues that we get. And we will not take a lot of your time. We know that you have a lot of other responsibilities. Thank you so much, Georgia. And right now, let's keep going. We have 2 presentations in our agenda, which are really important for understanding of our topic, to look at this topic from different perspectives. So without further ado, I would like to give the floor to the Ukrainian Foundation of Public public health, so that they would share more about the tools which this organization uses in the context of remote service provision. Olha, the program manager of the foundation, the floor is yours. Good to see and hear everyone. I want to introduce myself. Olha Luchynska, I'm the program manager of our foundation, Ukrainian Foundation of Public Health. The results for the online platforms as the space of support for people.
Трошки погано чути, так.
We hear you very, very bad. I will try to use my headphones. Can you hear me better? Now much better, thank you. The only thing, you will hear some other sounds due to the fact that we have renovations in the place. The most important thing, we can hear you, so. Okay, my presentation. Can you see my presentation? Yes, we can see your presentation. So, online platform Safe Women Hub. Why did we start this online platform, Safe Women Hub? Back in 2022, in general, our organization has been working in Ukraine for 30 years, but we mostly focused on the offline services, the social apartments for children and women in hard life conditions, the survivors of gender-based violence, and the daycare centers where we provide specific care and support. However, from 2022, we faced the situation that clients contacted us, but we had no chance to provide them the support because the specialists left and people needed this aid to strengthen the support, protection, and mental health and the human rights compliance, especially for women and girls. The online platform Safe Women Hub was opened where we provide social, legal, and mental health support. In our platform, we have psychologists, lawyers to solve legal issues, and we also have doctors, gynecologists, who from time to time provide counselings, and we refer people for that counseling and consultation. And of course, we have social workers helping with referral, documentation. They help understand where to go, what services are available, and they help with all the other social issues. We provide counseling for women or in all regions of Ukraine, including temporarily occupied regions. Sometimes we get the calls even from abroad, from our women who left Ukraine, went abroad with children. Those who still have a chance to contact us, they contact us. All the services are free of charge and confidential. Since earlier there were questions from our colleagues on how we understand, how we calculate the number of provided services and women who get the services. Every woman contacting us and get into our platform gets the individual number, and the consultant providing counseling writes down this individual number and reports to our system of online registration. We use FormShare, where we can look through not only how many times this woman had appointments, but where she was referred to and whether she got the other services, as well as those provided by other organizations and external partners. So we can track the full pathway of our beneficiaries contacting us for help. Our platform can be supported not only by the phone, but also by Facebook, Instagram, and a lot of people most people contact via Facebook, maybe that because this service is available not for youth, like those who use it. And also you can see that we provided more than 60,000 services from 2022 till May 2025. Out of them, 23,782 clients received 882 clients received the services, women. So in particular, the services and consultations were provided for GBV survivors. More than 121 sexual violence cases, conflict-related sexual violence cases were registered, and 372 sexual violence cases were officially registered by the workers of the online platform. You can see how many contacts we had and from where people contacted us. What services do we provide? Psychological counseling, information about the platform and referral goes second, and social workers consultations. However, the referral to partner organizations and support with humanitarian aid, especially for the IDPs, it is very relevant. And also we refer to daycare centers, social apartments, multidisciplinary teams, which also work in our organization and partner organizations, and integrated centers, which work jointly. I mean, these are the centers of integrated care where they also provide medical aid. The legal aid and counseling is provided in smaller amount, but still, and other services are reproductive health consultations, support, and so on. One of the main activities that we keep is not just about tracking the client, where the client was referred, but we also track the satisfaction of received services. And according to our researches and feedback from beneficiaries, and this feedback is collected anonymously, confidentially. We do not see who says what, but more than 66% of the cases of the reviews and feedback, they are positive. It means that our activity improves mental health of people. And briefly about Support Me platform. This platform has been working for a long while, from 2019. In these times, we can say that it's been working for a long while, because if we managed to keep it despite the availability of funding, it means that it is sustainable and the level of the services is acceptable. So this platform was created to raise the awareness of teenagers and their parents and those people providing support to teenagers about the specifics of teenage period. So we focus on problems of teenagers that they face these days. And the platform exists online as well, and people can contact by the phone and so on. So more than 7,000 consultations were provided in 2019 on the platform, like doctors and psychologists. We don't focus only on women, we also focus on boys, not only on girls, but also on boys, teenagers. Of course, teenage girls dominate, but there are also guys 25 plus, and also children younger than 10 contact us and write some questions via Instagram or some other platforms. Also, we can say that the most frequent requests are related to information about anything. So people ask for information about some questions. Also, they ask for psychological counseling, medical counseling, and referral about the services, and so on. Most often, we can see what platforms people use. Teenagers use mostly TikTok and Instagram. They direct message, and they also use official website Support Me, and on that website it's possible to choose each category individually and to understand what format and where to keep going, and following the recommendation of the friends and relatives and acquaintances, 27%. This is the source of contact with client. We also, and from other sources, people 11% contact us. So the most frequent requests that people contact us with is anxiety and depressive conditions, what to do if I feel panic attacks or something like that. The topic of contraception and reproductive health. This is a very important question because the doctor who is obstetrician gynecologist provides consultations, who used to work in the youth-friendly clinic specializing on teenage issues, about how to work, how to communicate with people. So very often there are questions to her. Then information about the platform it is, what to do about it. Then the next request is the family relationships with parents and partners. Then the general questions about somatic health. Teenagers find it always easier to ask remotely than personally something from the doctor. And all the other points you can see here. Bullying is also the request, but it's not in that huge amount, and mostly the priority is mental health. So what worked effectively? The fact that it's a very safe and simple space, both Safe Women Hub and Support Me, without any barriers. You can be with the video, without the video. You can name yourself differently. You can take any nickname. People will accept you without judgment, with whatever situation you have in your lives. That works positively. Multi-channel format. So the fact that you can get the support of the lawyer, gynecologist, social worker, of course, all of that helps contact people, and like they can text something. Professional multidisciplinary team that I highlighted, supervisions for the specialists, and the mandatory condition that the doctor, that the donor, that the doctors wouldn't work without is supervisions. With the donors or without, we still provide supervisions because there are some complex cases that you cannot solve right away, no matter how experienced you are. So it's an important point of our reality. Standardization and response. We've developed SOPs and checklists for all the cases. I mean, our specialists, before they get down to counseling, they clearly understand what partner is responsible for what, how to fill in documentation, how to respond if, like, you hear about the case of conflict-related sexual violence or sexual violence. Basically, we're trying to focus on our specialists and standardize their work so that they would be prepared for all the situations. Of course, we cannot consider everything, but anyway, we do our best. Just like previous speakers, I'd like to say that blackouts and digital illiteracy are the big challenges these days. No balanced mechanisms of referral offline and in the regions, changeable funding, especially, for example, we update the data on available services all the time, and this data needs to be updated almost every month. Yes, we can focus on some state services, governmental services, but anyway, due to big lines, waiting lists, and the fact that people don't want to go to the municipal institutions, state institutions, it's important to have NGOs. That's why we try to verify information all the time, but it takes a lot of time. It's also important to say about the fact that we have a lot of offline services. So what is it that we do? Social apartments, daycare centers, the right for house, burn house centers. on how to work with children if they survived any type of violence. Mobile teams of social psychological care, protect her safe spaces, resilience centers, and the online platforms. Then again, we work with all the population groups, and feel free to scan these QR codes to check out our platforms. I will gladly answer all your questions as I see it after our meeting. I hope I didn't take too much of your time. Thank you so much for the opportunity to share my information a bit earlier. Thank you so much, Olha. Thank you for the presentation and this important experience of the Ukrainian Foundation of Public Health. It's really important. And here I'd like to highlight in the facilitation of the meeting that in Ukraine, we have so much experience of the implementation of all the services remotely. We have so many elaborated methodologies and lessons. So we can see that from the level of presentations we have today and the level of experience people share with us. Of course, it's clear that these organizations are not the only ones. There are a lot of others which have the experience of providing remote services. So, of course, there are a lot of accomplishments which are really significant. That's why I want to thank you for sharing them. And I hope that this year it will be helpful, and it's already helpful for other colleagues. We will share the presentation, and we've already shared the context about the services. I had a few questions to you about, let's say, the number of service users, their age groups, categories, and so on. But you've already answered in your presentation. I know that your team is also in a hurry, so we will not keep your time. But if there are questions, we will share them with you. And we're going a bit over time, but still, I think that we have to listen to our final presentation. It is not the final. It's not the last, like by importance. It's the last but not least. So it's the Red Cross of Ukraine about the psychological aid which is provided remotely. So this is one of the points which helped us prioritize this topic and discuss it today. So right now I'd like to give the floor to Victoria Bondarchuk so that she would share the experience of the Red Cross in this type of care provision. And we know that this remote support is provided by the Red Cross of Ukraine for a few years. There are guidelines and recommendations starting from COVID. Victoria, the floor is yours. Thank you so much for joining us, that you stay with us to present this information despite going over time. Thank you. Today I will tell you more about psychological first aid. But I'd like to say that we have really a lot of interventions that we conduct remotely. The first time, I hope you can see my screen here. So the first time we faced this topic in COVID, and we had psychosocial support activities, and we conducted the psychological first aid trainings. And the COVID absolutely changed us, because when this happened, we didn't know how to change the format of our activity. We started the online activities on psychosocial support, which we conducted remotely. We started thinking on how to train people on psychological first aid. We started having trainings online, which we still provide for the volunteers, co-workers, ministries. We provide psychological first aid trainings in the online format. We cannot see the full screen of your presentation, sorry. Now we can see it in the full screen mode. Thank you. So how did it all start? We started using phone calls, messengers, video connection online, platforms like Zoom and Teams. We used everything. Also, we developed information materials, guidelines, everything you're doing. We were also doing that and changing the format in COVID. The first federation of the Red Cross and Red Crescent, they developed such guidelines on psychological first aid when it was impossible to communicate live, and it was during the pandemics, and right now we use it like during the war as well. So what is in that guideline? The algorithm of actions in the phone mode or online format, the advice and tips for emotional stability of the interlocutor, the examples of the phrases for active listening of the for the person providing psychological first aid, and the principles, the advice of self-regulation of the volunteer, and the principles look, listen, guide adapted for remote format. And if people say that they will provide remote psychological first aid, then we adapt all of that to the context, and people work on that live in our trainings when we do that, so they understand how to provide remote psychological first aid. The specifics of all of that is the communication without the eye contact, the importance, the heightened importance of clear and calm empathetic voice, ability to work with different emotional reactions of people, necessity to comply with confidentiality in home conditions, and the skills to refer to the other services when the situation exceeds the capacity of psychological first aid. Thank you. You shared today a lot about where to go next, so we will also thankfully cooperate next. And what is the difference? If we speak about the basic psychological first aid, where we're personally present, we observe the reactions, we can provide both physical care and support, we can see non-verbal symptoms. Well, here the remote one means that there is no physical contact. We use only the voice, intonation, and content. It's only about word support, no eye contact. We had cases where people, especially in the trainings, they automatically try to turn away and look somewhere else. So we tell people about it, that we are trained. Even online, we can see people like we're having this meeting, but we cannot see whether the hands are trembling because it's happening on the table. So we train people how to detect that and how to provide support if we see such symptoms. So what is happening right now? Right now, we have the information center, and you can see the phone number. People can call this phone number. We have the individual remote psychological first aid and the preparation and professional development for psychological first aid providers. They can learn how to provide the basic type of it. Remote one, we have the trainings on how to provide PFA to children, and more profound psychological first aid courses are provided. So when you can do that, you know that you can do that during the emergency, but we also developed the program for the elderly people, IDPs, the families of missing people. We also have the search service where they're trying to find the people who died or those who are missing, and they need to, like, their families, they need to get support because there are some questions which have emotional impact. Also, we use PFA in cooperation with different institutions like MOH and Ministry of Education. In COVID, we taught medical staff how to support each other, and it's used in the programs of mental health. Briefly, what is it that we understood? That it helps to stabilize emotional condition of people. It helps ensure some social contact in remote areas. We had during COVID the project where volunteers, they learned how to provide aid, and they ran a survey about COVID notifications. And back then we understood how important it is. This project was along the contact line for people who couldn't leave their villages, and for them it was very important to communicate with others. And like, we know that this type of support is accessible and safe. Different people, due to different reasons, cannot leave their homes, and it's different people of different groups, and this type of support is really important for them. It helps find solutions when the person is close to you and helps you find the solution or refers for support, it simplifies everything. It reduces the risk of complications because our volunteers are trained and we train people to identify the red flags when you need to ask for help or normalize the reactions and support those who help. Especially it's about us and volunteers and other humanitarian institutions, the ministries and other state institutions on how to do that. And likewise, we help them in the emotional burnout prevention, and we help them raise their efficacy in communication with other people, especially in terms of remote communication. I tried to be as brief as I could. So those who've been working with this for a while, we know about it, but in Donetsk Oblast, we know that they cannot provide some psychosocial support offline, like they still continue providing the online services and providing remote type of support. Thank you. Thank you, Victoria. Thank you so much for sharing this experience, that you joined us and shared this presentation. The topic is really important and interesting, this remote type of services, in particular psychological first aid. This is something that we discuss with different clusters when we discuss humanitarian response and evacuation. This is really valuable and important experience that we gained in Ukraine and the experience of Red Cross. Thank you so much for sharing that with us. And also, right now, we will encourage colleagues to contact you if it's like they want to share experience, exchange experience. We will share the guidelines you mentioned and everything else with the participants. Thank you, Victoria. I can see that there are no questions. Probably everyone is a bit tired, but anyway, we think that it's very important to listen to all the speakers and to see different perspectives of aid which can be provided remotely. So right now, let's finish our session, our meeting. Thank you for joining us. Thank you for listening to the presentation, asking questions, sharing your experience. Actually, I managed to see that we have great experience of remote service provision in Ukraine. Of course, there are some barriers in the formats, in the remote formats related to blackouts, related to the low digital literacy, related to mistrust in the online format. And we also understand that it's really important to comply with the recommendations, and it's really important to have the global guidelines to ensure high quality services. So we hope that this meeting helped you get more information on how to provide the services and improve their quality, but we will continue talking about it in other meetings. So at this point, I want to thank you that we joined our meeting, and we will share all the materials, the recording with you, and see you next time in 2 weeks in the briefing format. It will be June 19th at 3 p.m. and we will take a short break with the technical discussion for summertime, for the holiday time. So we will keep you informed about all the next topics via communication by Telegram and email. So thank you so much for being here with us. Have a nice day and take care. Goodbye. Thank you. Bye.